So, good afternoon, friends. I have a performance anxiety. Will you allow me few seconds to take deep breathe and out and do those things? 6, 4, 5, 3, 1, 2. No, it's not possible. When your amygdala is hijacked, you are hijacked. You can't do much. So, there are better ways. There are other ways to deal with this problem. So, let us start with some cases. At the outset, first, my thanks to AHA, especially Dr. Susma Ben, Samir, Nishchal, for giving this opportunity to share my experiences with this new therapy, or it's not a new therapy, but new for the audience here. So, how many of you actually know the full form of REBT? Just raise your hand. Full form of REBT. So, about 30% only know what is REBT. They have seen the brochure, but they still do not know what REBT means. So, here are some cases. Saurav, 16-year-old boy, extreme fear of speaking to people, like I was having now, got self-defeated in chess tournament. I mean, this is very interesting. He was a brilliant boy, was a brilliant chess player, but he used to get himself self-defeated in the finals because he feared that if he gets the trophy, he will have to give an acceptance speech. Another boy, Ibrahim, 17-year-old, cannot control his anger, often ends up throwing things or even hitting people, like he would hit up mother also. Dhara, a 14-year girl, is terribly disturbed because a street dog was bitten by a neighbor. The dog suffered a lot of injuries. She is an animal lover and she is now sad and has lost interest in the activities that she was enjoying. So what happened to these three cases? After an introductory counseling session, few sessions of REBT were done. And what are the results? Saurav, now he attends marriages, walks confidently to the stage and talks easily with the bridegroom as if he knows him since long. He came again when he entered college. Now he is seeking help for making friends with girls in the college. Ibrahim, a spoiled brat of his rich father, has gradually been able to control his anger now, and the intensity and frequency of anger has come down. Dhara has now become, she has overcome her sadness and started giving short talks to suitable small audiences in her society about animals, and she is mulling the idea of joining an organization for prevention of cruelty to animals. What has brought this change? And when you do counseling, when you do therapy, you are actually touching lives. So recently we had this course in mental health by ICP. There also we discuss all this. What are we all learning this for? Because we are touching lives. Day in and day out, we are treating fever, cough, cold, but there is life and health beyond physical health. So here is some testimonials like this. One 25-year-old man had come, was referred by a psychiatrist to me. He was suffering from bipolar. And this Teacher's Day, few days back, he wrote to me, "Happy Teacher's Day, Dr. Satish. In my toughest and darkest days, your guidance and presence gave me strength I couldn't find elsewhere. I have sought therapy from a few, but the comfort and clarity I have found with you has been the most comforting. I deeply value your wisdom and look up to you, not just as a therapist, but as a true teacher of life." Now, this is very gratifying. You are actually touching lives. Another boy, about 21-year-old boy, has studied abroad, was staying with the parents, but suffering from schizoid personality disorder. He had physically and mentally moved away from the parents. So his parents wrote, "Thank you. Thanks for your efforts in bringing our son back to us." So this is what some therapies do. So what is REBT? Rational Emotive Behavior Therapy, founded by Albert Ellis. This title of this session, if you remember, is Deep Diving into Counseling. This is a very thoughtful kind of session because it has a deep meaning. Adolescent medicine has come a long way for us. In IAP, it started somewhere about 25 years back with Dr. Swati Bhave and Dr. N.K. Sinayar, heading the whole movement of making us aware about adolescent health. But we have traveled a long way. And we have learned our lessons from the God. God is the acronym I had given. About a couple of years back, I had interviewed 6 iconic people in the health sector. And I had given this acronym, Guru's Odyssey of Dedication. So our gurus, M.K. Sinayar sir, Swati madam, They have traveled long journeys and we have learned lessons from them. But now is the time to move further on. Now we have to move beyond Mission Kishore Uday and no other things program that we have been doing for such a long time. Every pediatrician who deals with adolescent needs to learn basic counseling. We have to now go beyond that and learn certain therapies also. Because day before yesterday only we had a workshop on emotions. And every other talk would end up with treatment strategy would involve CBT or REBT. So one delegate very boldly asked, what is CBT? What is REBT? We don't know. We are knowing about emotions now, but how to offer these therapies? So every pediatrician dealing with adolescents need to learn some counseling and beyond that. And that is the deep dive. This session is the deep dive. There are certain very basic things, I will not go about it. Differences between various tools like advice, guidance, counseling and psychotherapy. REBT is a psychotherapy amongst many others, a form of CBT. CBT is basically restructuring your cognition or thinking. So there is a question now. In all such sessions which I attend, there is always a question, and some of the experts also advise against using psychotherapy. Unless you are so well trained, you should not offer psychotherapy. I have a little difference of opinion. Dr. Neelam Mohan in the morning also brought out this point that we have a dearth of mental health professionals. Do you know what is the ratio of population with clinical psychologists? There is only one clinical psychologist amongst 3 lakh population. Now, how can we reach out? We are making people aware about mental health issues, and there are not many mental health professionals. So the onus is on pediatricians to take up that mantle. So we need to fill that gap. And this is very one good sentence which public health people talk about is perfect is not enemy of good. So in your mission for doing things very perfectly, you may not actually achieve the target. So good is fine. You may not be perfect, but good is fine to deal with large number of people. So we need to, in private practice, we need to have this approach of public health approach. Of course, you do not label yourself as therapist. You may not make tall claims, and you know your limitations. So this talk I am dedicating to that theme that we all need to learn certain things and use them in our day-to-day practice. And this is just an overview of REBT because it's a huge subject. When I teach postgraduates REBT, I take 18 hours of sessions with them. So this is 20 minutes only, but we'll try to give an overview. So why do we need such therapies? The goal of life, if I ask anybody, it's happy survival. And happy survival means you become unhappy when there is obstruction to this goal. No, you give this whole umbrella of this. This is a very profound statement that goal of the life is happy survival. So there are so many things happening in our day-to-day life which obstruct this goal. And people are, so these are certain basic, thought processes of REBT. People are emotionally disturbed not by things around them, but by the distorted thinking and irrational core beliefs. Unconditional acceptance of self, others, and the world or life is very, very important. We have to unconditionally accept what is happening and then work upon it. Our emotions emerge mainly from the beliefs. So REBT emphasizes mainly on beliefs, evaluations, inferences, interpretations, and reaction to the situation. REBT does not believe in absolutism. It says that life is not always black and white. There is more gray to it than black and white. It is not about, so there are certain people who would, by the spelling of this rational emotive behavior therapy, would think about that this is something related to rationalism or rationalizing. No, it's not about, it's about logical thinking and your belief systems. Again, there are certain terms used like say, when we talk about emotions, there are positive versus negative. Amongst the negative emotions, there are healthy negative emotions and unhealthy negative. So this is a very, very important terminology which will be used throughout the talk. And beliefs are again of 2 types, rational beliefs and irrational beliefs. We will go into details, what do we call this. Now this slide is very, very important. And you may not click, I am happy that some people are clicking my slides, but I am going to share this in the delegates group, the whole presentation, so you may not bother about taking the pictures. Focus on this slide. So REBT again has a ABC model, situational ABC model. where A stands for activating event or adversity. Suppose my talk is planned here and this audio visual system doesn't work. So that's an adversity. I worked so hard on preparing this 20 minutes of talk and my audio visual is not working. My presentation has crashed. So that is an adverse event. So what can be my reaction? Anxiety, anger, whatever. So what usually we think that it was the crash of my audio visual system which caused me anxiety. Whereas REBT says no, there is a B in between. So A is activating event and C is the consequence, which can be an emotion, it can be a cognition thinking, it can be a behavior, or it can be action tendency. So most of us in our day-to-day life would blame the A for C. But REBT says, no, there is a B in between. And B, what is B? B is the belief about that A. Whatever adversity has happened, how do you think about it? What is your belief that you are holding about it? And now again, beliefs are of two types, irrational belief and rational belief. So if you are holding an irrational belief, your emotion will be unhealthy, negative emotion, and you will end up with non-constructive behavior, self-defeating behavior. I will start talking, I will be having a panic attack. But if I dispute that irrational belief, my irrational belief would be that, no, this must work, this should work. What are all these people doing here? So I am having a very dogmatic demand from others that this system must work. That is an irrational belief. So I dispute that belief with certain techniques which I will talk about later on. And by changing this irrational belief to rational or effective new belief, my emotions will change. Instead of anxiety, I may end up with concern. Instead of anger, I may end up with little annoyance. And that healthy negative emotion will lead to a constructive behavior, positive or self-helping behavior rather than self-defeating behavior. So that is A, B, C, D. A is activating event. It leads to consequence, but there is a B in between. If you are holding an irrational belief, there will be self-defeating behavior. If you are able to dispute your irrational belief and convert it into a rational belief, it will emerge into an effective new belief system, whereby you will get a more healthy and a better feeling, and that will lead to a more constructive behavior. This is the whole crux of REBT. And on each of these A, B, C, D, E, F, there are chapters on it. So if you can understand this, if you start applying this to your own life, you'll be very, very comfortable dealing with various situations. So now we'll take up one by one briefly. Irrational beliefs are rigid, rational beliefs are flexible. These are extreme or exaggeration. These are non-extremes. These are false. There is no proof. These are true. These are illogical, insensible, or childish. These are logical beliefs. They are self-defeating or non-constructive. These are constructive things. So how to assess irrational belief? How do you actually label a belief as an irrational belief? So I offer a 35 statement DAS, that is dysfunctional attitude scale, where there are 5 statements for each of these 7 domains. And depending on that, I can judge which domain I need to work upon for the client. So there are 7 domains of approval, love, achievement, perfectionism, entitlement, omnipotence, and lack of autonomy. All of us actually fall into one of these domains, where predominantly our irrational beliefs are based in these domains. So I'll take few, out of 5 statements, I'll put only one. So those who seek approval, they think that my value as a person depends greatly on what others think of me. So they always need a seal of approval. And how does the consequence happen? They evaluate themselves through the eyes of others. Their emotional well-being is dependent on their imagination about what others think about. Anxiety when criticized by others, and people pleaser, and they cannot say no. Coming to love, I cannot find happiness without being loved by another person. This is an irrational belief. If a person I love does not love me, it means I am unlovable. The consequence is they see love as a need of survival. Self-image is unconsciously, they believe about self-image that they are not lovable. Talking about achievement, if I am to be a worthwhile person, I must be truly outstanding, at least in one major respect. If I fail at my work, then I am failure as a person. The consequence is you become workaholic. You cannot take failure in your stride. If you are very perfect, the irrational belief is if you can't do something well, there is little point in doing it all, so you end up not doing much. So consequence is satisfaction is missing, life is joyless and tedious. There is unrealistic, impossible standards you are setting for yourself and others, and you want to fix things up. So there is a price to perfection. And people say that perfection is stagnation. Entitlement, irrational belief is I put other people's needs before my own. They should help me when I need something from them. So all my postgraduate students would argue a lot about this. What is irrational about this? When you take these things, your beliefs to an extreme level, you end up with more distress. The consequence is you feel entitled to things like love, success, happiness. You expect and demand from others to reciprocate for your good work. And when those things are not met, you feel frustrated and sad. Omnipotence means all powerfulness. You think that you can control people, you can control your children, you can control your colleagues. So I should take responsibility for how people feel and behave if they are close to me. The consequence is you blame yourself for others' actions and attitudes. Your strong belief that you are all powerful is crippling, and this we have seen in many adolescents, parents. If adolescent is doing something wrong, the parents feel that the onus is on us and they feel guilty about it. Lack of autonomy means I cannot control how I feel when something bad happens. So they think that I cannot control. આવું તો થાય જ નહીં. મને દુઃખ તો થાય જ ને આવું થાય તો. So are trapped in belief that your potential for joy and self-esteem comes from outside. And these are, after having had a look at domains of various dysfunctional attitudes, these are some of the classifications of what irrational beliefs can be put into. So most of them actually are dogmatic demands. The rest of them are coming out of that. Dogmatic demands means from self, dogmatic demand from others, and dogmatic demand from the life. And they use the word must. That is, sometimes this therapy is labeled as masturbation. So a lot of people put their emphasis by putting the word must and absolute shoulds. Whereas with non-dogmatic preference, you would wish, or you would want, or you would prefer. Awful, I think it's awful, terrible, horrible. These people would say it's bad or unfortunate. Low frustration tolerance means I can't stand it. If AV doesn't work, I can't stand it. I would say no, I don't like it, but I can stand it. I can find some solution to it. And self and other rating like I am not good, she is not good, and the life is worthless, the world around us is not good. So not globally rating self or others, and I and others are fallible human beings. That's very, very important. That this feeling that we are all fallible human beings helps you a lot. Can use several exchange words and sentences. So when you are actually doing counseling, you offer them a plate of various sentences and terminology that they can use. Another concept about your inferences. Inferences are distortions of the reality. If I see two people talking there, my inference could be that they are saying that this is not a good talk. Or my inference could be that they are not attending to my talk. But I may be wrong, and there are 7 ways in which you can go wrong. Black and white thinking, filtering, overgeneralization, mind reading, fortune telling, emotional reasoning, personalizing. So these are the ways in which you can go wrong. And now after having talked about belief, let us talk about emotions. Negative emotions are part of life. When faced with adverse events, it is healthy and all right to feel negative emotions. Some people take this therapy, misunderstand that it's talking about not having emotions. No, we are not talking about stoicism. We are talking about emotions only. So it's fine to have negative emotions. We are all human beings. But then how do we classify? How do we look at those negative emotions? Negative emotions are part of life, but some of them are healthy, some of them are unhealthy. So anxiety versus concern, depression versus sadness. Depression here I am not meaning the disease or psychiatric disorder. It's a feeling. Unhealthy anger, that is rage versus annoyance, guilt versus remorse, shame versus disappointment, hurt versus sorrow, unhealthy envy and jealousy versus healthy jealousy. So when you are trying to understand emotion, we have to dissect it. And there is a very simple way of it. Identify and name the emotion, categorize it as unhealthy or healthy. Then think about the possible cause or triggering event. Every emotion which I had listed here would have some irrational belief behind it. State a belief, and then the consequences, cognition, emotion, behavior, and action tendency. I'll take up only 2 examples here for sort of time. So when does anxiety happen? Because the activating event is a threat or a danger. If heavy stops, I am feeling a threat. So I am anxious about it. So Saurav, who was afraid of talking to people, people, his belief was that I must make good speech. I am not good at speaking. It will be terrible if people laugh at me. Whereas a person with rational belief would say, I wish I would make a reasonably good speech. It will be unfortunate if I falter, but I can handle it well. All human beings are fallible. The consequence for this belief would be overestimating the probability of threat occurring and underestimating your own coping ability. These are two major things. We either overestimate the threat or we underestimate our own ability, and the behavior is withdrawal. Here, realistic about probability and realistic about coping therapy. Anger. Anger happens when person disregards another person's rule of living. There is goal obstruction or threat to self. Always ask this question, why I am angry? The reason behind that is that you have made your own rules and you think that others should also follow those rules. So when that is broken, you get angry. I have now grown up. My parents must not restrict my use of screen. It is terrible and I cannot stand it. Whereas the other person would say, I would prefer that my parents would not restrict my screen time. But if they do it, it is unfortunate. I can handle it. I can sit down with them. I can talk to them. So these people are the ones who overestimate other person's transgression. They see malicious intention. They are self-righteous. They are unable to see other point of view. And they damn the other person and seek revenge. And that is, we see in and day out, why adolescents are becoming violent. Yeah, I will be finishing in 2 minutes time. So these are the various behaviors of anger and non-anger. What is the process of REBT? Having looked at A, B, C, D, E, F, G, now how do we go about it? We assess the activating event, we assess the consequence, we assess the irrational belief, then we dispute it, and then this new emerging feeling will happen, and then we set up the goal. So activating event is what would a camera see? What do you think happened? Belief about A, how do you find it out? What did you feel? Tell yourself. And consequences are all this, that what did you feel? What did you do? This will define your belief. Then disputing. These are various ways in which we cannot go into details because of lack of time, but empirical argument. So you have to become like a barrister or an advocate against your own belief system. You have to confront those irrational beliefs and try to find out the right beliefs. Goal setting. Whenever you talk about talking to any adolescents or their parents, it's about therapeutic alliance. We need to set goal for our own self, goal for counseling, and there can be specific short-term goals, there can be broad goals. And this one concept is also very important, hate versus internalize. You are all intelligent people. So you have understood REBT, but whether are you able to internalize it? When the situation arises, are you able to use that or not? And we give self-help form also, that's an home assignment, a single sheet paper where they write down all A, B, C, D, F, and they come back to us and we sort of dissect it. And these are the various indications. During your routine counseling, you can, actually it's a very good tool for your own inner growth. People will start noticing change in you. Then anger management, behavior problems, all these conflicts that we see, and see these are some of the disorders where they are used. REBT and CBT, do not confuse between the two. It was REBT which started earlier.
Sir,
then
we have
CBT,
last 1 minute.
Yes, just a minute. This last slide is there. And then there was a convergence. If REBT, Beck is called father of CBT, then Albert Ellis is called grandfather of CBT. But now REBT is also taken up as a part of CBT only. And this is my summary that as a pediatrician, we should have some basic skills of counseling. We need to learn certain therapies, knowing the limitations. Thanks for your attention.
Thank you very much, sir, for the deep dive that you took all us into the REBT, the difficult topic in a simple language. Thank you very much.